Good morning, everyone. Thank you for being here. I'm Peggy Maguire. I'm the president of the Cambia Health Foundation. Cambia Health Foundation is the corporate foundation for Cambia Health Solutions. We're headquartered in Portland, Oregon, so this is very early for me. But I'm really excited. We've been planning for this day for a long time, and I want to add my thanks to the planning committee and to all of the speakers. I think we're really in for an engaging and informative day. Cambia Health Foundation has been investing in palliative care for about a decade because we believe that it changes the experience of people with serious illness and supports their family caregivers. We also believe, as James said, not only is this area of serious illness care an area within healthcare that requires special attention, there exist disparities within serious illness care. So I think these issues are best viewed as social justice issues. How we advocate for people with serious illness and their caregivers is a measure of who we are as a country. And I think it requires us to look at these issues through a health equity lens, which means listening to people that we serve, acknowledging their experiences, and then challenging ourselves to take a hard look at our own institutions and organizations and how they may perpetuate bias. Today, we want to challenge your thinking, but we also want to inspire you to take action to change the status quo so that all people with serious illness have access to high-quality palliative care in the setting that's right for them. Darci will provide an overview of the day and the framework we're using for this day, and then I will introduce our first panel.
Good morning, and thank you, Peggy, and thank you to everyone on the planning committee and all of you who got up early this morning to be down here with us. We greatly appreciate it. It is an honor to be here with all of you today to talk about access, equity, and serious illness. And before we launch into the first session, because I know we want to get into the meat of things, I just want to underscore kind of two framing sorts of things. One, in 2001, the Institute of Medicine, now the National Academies, put forth the 6 domains of healthcare quality. And one that we don't always talk about is equity. So every time we talk about equity today, I want to remind folks that we're talking about a fundamental part of quality. So when you go back to your organizations, when you go back to those institutions, and you're talking about this, and folks are saying, but that's extra, or that's someone else's department. It's not. It's a fundamental part of the quality, and we're all here to improve health quality. Next, I want to talk about how we organized the session. And as the planning committee, we wanted to make sure that we weren't spending the day rehashing the issues and going over the numbers that we're all too familiar with. And we recognized the fact that we needed to address access and equity at all the levels, if so to speak. And so when we wanted to focus in on those solutions, we looked to this socio-ecological model, which kind of addresses all of these different layers. So as we move through the course today, you'll see sessions taking on the organizational and community level perspective. We have a session on the individual and interpersonal perspective. And then, of course, we have the policy perspective. And going through these different layers and identifying solutions that work with those levers and work with those organizations allows us to see the multitude of people that can come together to find the solution. Because there isn't one organization, one individual, or one policy that is going to fix the issue of equity and access in serious illness, but it's going to take all of us collaboratively together. So thank you, and with that, I will turn things over to our session 1 moderator, Peggy Maguire.
Thanks, Darci. It really, I think this is a great framework for the day, and hopefully you will think so too by the end of the day.